Hello, my name is Cecilia Low Wang. I am a professor of medicine at University of Colorado Anschutz Medical Campus in Aurora, Colorado, and vice chair of the American College of Diabetology. My topic today is CKM review. This is a hot topic these days, and so I'm hoping to give you just a few tips and definitions. So, first of all, what is CKM syndrome? So I wanted to start off with the top highlight from the Cardiovascular Kidney Metabolic Health Presidential Advisory that was published just a couple of years ago. And the very first highlight is the definition. So this is kind of an overview of what CKM syndrome is. So it's a health disorder that's attributable to the connections between obesity, diabetes, chronic kidney disease, and cardiovascular disease. What do we mean by cardiovascular disease? That includes heart failure, atrial fibrillation, coronary heart disease, stroke, as well as peripheral arterial disease. And it includes people who are either at risk of or have existing cardiovascular disease. So, what's the official definition of CKM syndrome? Here's the official definition. So it's a systemic disorder characterized by pathophysiological interactions among the metabolic risk factors, chronic kidney disease, and the cardiovascular system, leading to multi-organ dysfunction and a high rate of adverse cardiovascular outcomes. And it includes individuals who are at risk for CVD due to the presence of the metabolic risk factors, CKD, or both, and individuals with existing CVD, potentially related to or complicating the metabolic risk factors or CKD. So it's a really all-encompassing definition that includes any and all people who are at risk of or who have different elements of cardiovascular, kidney, and metabolic syndrome. And the increased likelihood of CKM syndrome and its adverse outcomes is further influenced by unfavorable conditions for lifestyle and self-care that result from policies, economics, and the environment. So this is an additional point that I really wanted to highlight. So this is a cardiovascular disease focused syndrome, so CKM syndrome, and really it's because individuals with metabolic syndrome, diabetes, and or CKD mainly die from cardiovascular disease. So I think there's a very good rationale for this to be cardiovascular focused. So what are the stages? So stage 0 is people with no risk factors. And this is where it's important to focus on what's called primordial prevention and preserving cardiovascular health. And the other extreme is stage 4. So people who have clinical cardiovascular disease in CKM syndrome. So people with existing coronary heart disease, heart failure, atrial fibrillation, stroke, PAD. And then in between are the different stages of variable risk. And so, for example, stage 1 involves people with excess or dysfunctional adipose tissue. So people with overweight or obesity, people with abdominal obesity, who may not have markedly elevated BMIs, and also people with impaired glucose tolerance. Stage 2 includes people with diabetes, and so this will constitute the majority of people that diabetologists will see. So people with metabolic risk factors and CKD, including type 2 diabetes, hypertriglyceridemia, hypertension, metabolic syndrome, and or moderate to high risk CKD. And one point I wanted to include and highlight here is that this also includes people with chronic kidney disease with non-metabolic etiologies for their kidney disease, as well as people with non-metabolic etiologies of their hypertension. Lastly, a stage to be aware of is stage 3. So this is people with subclinical CVD in CKM syndrome. So people with subclinical atherosclerotic cardiovascular disease or subclinical heart failure. And so there are some definitions of the risk equivalence of subclinical CVD in this stage. Those are listed at the bottom of the slide. So why come up with this CKM syndrome definition now? There are a number of different reasons. So the first is, of course, preventive. So we want to identify individuals at high risk for CKM morbidity and mortality and start those preventive strategies before they get end organ damage. The other thing is that this syndrome definition integrates contemporary constructs of cardiovascular health. So this is kind of a new thing. We've had lots of research over the previous recent decades, and this definition tries to integrate all of those things. This is the hope is that this unifying definition will facilitate communication between the scientific community as well as community stakeholders, and to have this syndrome taken into consideration when health policy is being determined and when research investments and public health initiatives are being developed. And then lastly, it recognizes the importance of social drivers of health and the importance of positive health promotion and preservation across the life course in populations and individuals. So, bottom line, what do I need to know and do for my patients? I think it's important to know the stages of CKM syndrome and then be able to access the resources. So, the first ever CKM syndrome guideline will be released in 2026 by the AHA and ACC. I'm one of the guideline co-authors, and there will be companion resources for CKM syndrome by the American Heart Association that are being developed. And ACD is working to support the AHA in these efforts. So just some last key points about CKM syndrome. So learn more about it, and then think about CKM syndrome in every patient you see. So what stage does the person have? What prevention strategies and resources are needed? What screening is needed? And then what can be done to address your patient's risks and prevent progression of the CKM stage? And then lastly, and most importantly, maybe, to kind of our population health and all of our patients nationwide are, what can I do to facilitate a team approach to CKM syndrome, break down those silos, and work with other members of my patient's healthcare team? So one of the big problems of our healthcare system has been the siloed practices and kind of siloed ways that we practice. And I shouldn't say siloed practices, but I think that we tend to have difficulty breaking through those silos and giving our patients kind of that holistic care that they need. And so I think it's important that we as diabetologists and primary care providers think about this. And that's the end of my presentation. So thank you so much for listening.